Welcome to the Purity Pulse podcast, your go-to podcast for the natural health industry and everything Purity Life. I'm Julie Drapeau.
And I'm Erin Macklin.
And today we're going to go through our weekly check-in. Mm-hmm. We have a special guest, Sherry Torkos. She's a pharmacist, an author, certified fitness instructor. And then we'll go into what's new to Purity Life. So, Erin, tell me about your week.
Well, it's Valentine's week. I was curious what that I can tell you a little bit about what that means for me. I'm curious what that also means for you, because I know everybody celebrates it very differently, right?
Yeah, I think I like the idea of Valentine's. I love little hearts. I love the...
She says that she's got hearts on her nails.
Exactly. I just love celebrating. We're going to talk about in another episode, we'll talk about the working genius and being a galvanizer. Any occasion to celebrate or to have fun or to have ideas that way. So for us, I would say it's not like having a card and the cake or the chocolate and the flowers. Yeah. No, it's not about that at all. Yeah. I would say just personal to myself and just having those little pieces that reminds me of love, generally speaking. It's kind of an internal process.
Right.
I would say that Valentine's is like an everyday thing. Yeah. I would say it's not just one day of the year. But what about you with kids? And does that change?
It's true. Yeah, right. Like the focus changes for sure. It's with kids. You got to, especially when they're younger, you got to prepare because there are expectations to be bringing Valentine's cards to school, and there's got to be one for each kid.
That still exists?
It still exists.
Really?
Yeah, it's still a thing. It's still a thing. And now, I mean, you got to keep it interesting, right? It can't just be out of the box sort of whatnot. So my kids are always, I want to add a pencil to it, or I want to add this to it, so you can give like a little gift or something too. Last year we did, my youngest was really excited because I found these cards that you could put almost a sticker, like a scratch off sticker. Okay. So he could write the message underneath and then put the sticker on top, and then the kid that received it could scratch off to see the message.
Oh, that's awesome.
That was a big hit. We might do that again this year.
And in store it still exists though.
Oh yeah,
right. We see like end caps and chocolate, and even in our industry, we do lots of pre-books and preparation in that sense. So it's fascinating.
Yeah, still a big thing.
This episode is sponsored by BioSteel. BioSteel's mission is to create the healthiest and most trusted sports hydration product on the planet. Whether you're a pro athlete, the next generation of athletes, a weekend warrior, or just living your everyday life, BioSteel is the better hydration option for you. The best kept secret in sport is no longer a secret. BioSteel, clean, healthy hydration.
So thanks so much, Sherry, for coming. We're so excited to have you.
Thanks for having me.
Thanks. Maybe you can tell us a little bit about, I know you. We've actually traveled together.
Yes.
But maybe you can tell our listeners a little bit more about your background and what's gotten you into the position that you're in right now.
Sure, yeah. So I've been practicing pharmacy for, when I say this, it's hard to believe, 30 years.
Yeah.
Long time. And when I first decided I wanted to go into pharmacy, it was primarily because I was fascinated by the human body, health, just the magic of thinking that medications could treat diseases. So, go into pharmacy school with that mindset, and I certainly learned a lot. Yeah. But while I was in school, it also became very clear and apparent to me that drugs don't have all the answers. And there's so much that can be done from a nutritional perspective and through supplements to help treat and actually prevent a lot of the diseases that plague so many people today. So when I started practicing, I started integrating holistic therapies into the way I practiced. Early on, I met Matthew James, who introduced me to Quest vitamins at the time and other brands, which I brought into the pharmacy. And I think the most powerful reinforcement for me was seeing the impact that these things had on people's health. So they're taking their medications for, say, diabetes or high cholesterol or whatever it may be. But once they started taking supplements, getting better results, less side effects with medication, feeling better, and then winning over the doctors that I worked with. Because at the time, this was in the mid-90s.
Big challenge.
When there was a lot of skepticism about natural medicine. Doctors were, discounting it and it didn't have the acceptance it had today. And so educating the doctors, bringing in naturopaths and scientists to give them the information, the research, and then getting them on board so they felt comfortable even recommending things for me. And that was like one of the most powerful things that I experienced early on in my career.
Yes.
And I've been really lucky in that I don't just work in the pharmacy. I've now segued into doing consulting work. I do a lot of education to
TV,
consumers. Yeah, I do a
yes.
lot of TV.
Yes.
Just trying to get the message out to people about holistic therapies. And not that drugs are bad, but let's start first with looking at diet. Let's look at supplements. Let's look at some other things that we can do.
Yeah.
So I've integrated all that, and also pulling from my background as a fitness instructor and encouraging people to do some of the basic things that really can have a powerful impact on their health.
The impact that movement can have on
Movement's
health as well,
huge.
Right?
Yeah.
The
Cut your
complete
risk
solution.
of so many chronic diseases, right?
Absolutely. And we talk more and more about that. So when you started, it must have been like a lot of challenges because you were really going against the grain, where now there's a bit more like that openness, right?
That's right. It was like an oxymoron. When I first started practicing, it was like an uphill battle. I was like swimming against the current because very few pharmacists were practicing that way. Matthew introduced me to Farid Wasif, who's a holistic pharmacist in Stouffville. The three of us used to go to health conferences, and then I met more pharmacists that were interested.
Yeah.
But I think the obstacle was that when you're in pharmacy school, your education is primarily drug focused. Nowadays, they do educate more on botanical medicine and nutritional therapies.
Okay.
Yeah, that is integrated. I went to school in Philadelphia, which was a very progressive school, and they did dabble and talk a little bit about that, but it certainly wasn't the focus. But today, pharmacists are getting more education in that area, and also continuing education opportunities from the industry. And that is so powerful.
That's one thing that when I was a rep on the road and we had pharmacies to visit, I found that there was some pharmacists like that they were open-minded, and others definitely that were, nope, here's the book and here's what I'm going to give you, and they were not open to that. But others like you, they were interested in understanding how those two types of medicine could work together. So it was definitely very encouraging. And now that, people like you that, continue to, go out with the message and in different media and speaking. And it also helped not just on the pharmacist side, but you have the natural side of people thinking that it's okay to work together.
Yeah,
it's
absolutely. Not one or the other.
Yeah,
that's right.
Yeah, exactly. So
and that's something that I always try to convey to doctors and to patients. I'm not here to get people off their medication. Maybe if we can reduce dosages, maybe if we can make some adjustments. But there's a lot of times where a patient can't tolerate a prescription medication. They need a natural alternative. And so we can have better health outcomes if we can integrate them in a complementary way.
Absolutely. Absolutely.
I know too you've written a couple of books. I know you have a bit of a specialty also in heart health. Can you talk a little bit about heart health and disease prevention?
Sure, yeah. So it's funny because I didn't seek out to become an author when I finished pharmacy school. This is something that just evolved.
You were so much in books already. It's like,
I never really thought, but I started writing booklets or articles and then booklets, and then I got some book deals, and I've been very grateful for those opportunities. And one of my most recent books is called Saving Women's Hearts, which is something near and dear to my heart because I have had a lot of family members touched by heart disease, as most people have. I mean, it still remains one of our biggest health threats, cause of death, actually more so than breast cancer and some other conditions that we tend to think of more as health concerns. So heart disease is something that I'm passionate about because like many diseases, there's so much that we can do towards prevention.
Right.
And it's so much easier to do that versus wait till the bomb drops and we have a heart attack.
Exactly.
The big one, or the stroke. And then it's, there's still things you can do, but it becomes a little bit more difficult. So I've been very passionate about educating on the value of holistic therapies for heart disease prevention and management.
Yeah, because as you said, we talk about a lot about breast cancer. Like there's a lot of advertisement and
there's good awareness.
Good awareness, but
Yeah.
for heart health, it's like
Not as much.
we know it's bad and we know but it's not spoken as much. I feel
It's
that
true.
out there.
It's true. The awareness, especially for women. I mean, when we think of heart disease, we often think of a middle-aged, overweight man with a pot belly, clenching his chest.
Yes.
We don't think
Yes.
of, and there's been otherwise fit, young, healthy women that have heart disease. I mean, there's so many risk factors that can be at play above and beyond the high blood pressure, the cholesterol. I mean, stress is such a big issue today, especially for women, as we're trying to juggle multiple things, careers, family, trying to be everything to everybody. There's a lot of stress and pressure on women. And
So there's a big difference between sexes on, how cardiac disease would present. Like
there
shows
can be.
differently?
There can be. In fact, women sometimes do have the similar symptoms of a heart attack, the chest pain, but sometimes it can present as just unusual fatigue.
Right.
And I mean, how common is fatigue?
How do you peg
we don't
that
have a
down?
good night's sleep. We're tired.
Yeah.
We're stressed. We're fatigued.
Yeah.
So
you
you
don't
can
take it
have
as a marker.
preceding fatigue, unusual fatigue, nausea, just feeling dizzy, faint. Those can be symptoms that can be more prevalent in women, or having pain in the shoulder or neck that radiates. So it's important for women to know those risk factors and to be screened for heart disease.
Right.
So
Early.
Early.
Early. Like, don't wait until you're 50. Have a screening in your 30s. Know your blood pressure, your cholesterol. Have some specific tests done that your doctor can work with you on, so that you know where you're at and you can monitor if things change.
Yeah, we've done with, I think, Matthew and I, with Dr. Budov in California, the test to see your blockage in your arteries.
Looking at coronary artery calcification. Yeah, Dr. Budov is fantastic.
Yes, and it's fascinating to get the results on that and to see where you're at, because you can feel like you're okay, but
there could be something going on.
Yes.
And that's the big thing with heart disease. Sometimes there's no symptoms until the big one happens.
Yes.
And because we don't know what's happening in our blood vessels. And sometimes people may have angina, shortness of breath, chest pain, things like that. There may be some symptoms, maybe not. So having, investigational procedures like that, so you can look at that. Because if it is coronary artery calcification, there's something you can do about that.
Right.
Yeah, exercise, aged garlic extract.
Yeah.
That can be very, very powerful.
Yeah, exactly. And how would you define or give example of the conventional treatment compared to what we can do in natural?
Well, so I think when it comes to conventional treatments like drug therapies, we're looking more so at dealing with the symptoms, managing high blood pressure, managing cholesterol. Whereas with holistic therapies, we can work on prevention and also management.
Yeah, absolutely. So we talk a bit about aged garlic extract. We do have Kyolic that we have, but there's a lot of other brands out there, and we're talking to retailers as well on this podcast. So I think it's important for stores to highlight that, because it just becomes just another product or category on shelf. But I think to bring that awareness, that there's value to that. To
Absolutely.
bring to light.
In fact, like aged garlic extract is one of my most commonly recommended supplements for heart health. And the reason for that is that it targets so many different areas. It helps with blood pressure, helps with cholesterol, reduces inflammation, it reduces plaque progression, it helps improve microcirculation. I mean, there isn't any drug or any other supplement that can do everything that Kyolic, aged garlic extract, does. And I've just seen firsthand the benefits when I have had patients take it. I've seen the research, and I mean, from going to the
research,
International Garlic Symposium,
Yes.
the research. I mean, I don't know any other supplement that is backed by like 900 scientific studies. That's extraordinary.
Yes.
Really, they pour so much into research because they believe in their product, and we see the studies. The healthcare professionals recommend it, and people have good outcomes.
Yes.
So it's I would say a staple.
100%.
And for most people that are looking for something to support heart health, that's where I would start, that and fish oil, because those are two things that offer multiple health benefits and really side benefits rather than side effects.
Right.
Yeah, which is key, and because there's a lot of trends and
Yes.
TikTok trends.
Yeah.
And
Oh, yes.
I'm sure you heard about the berberine and the
Berberine for weight loss and blood sugar control.
Yes.
Nature's Ozempic. Yes.
Yes, and now they're trying to give it a tangent on heart health as well. So they're pushing that
Yeah.
way. It's like
I don't think the science is quite there yet. I think
That's-
the heart health benefits,
Yeah.
possibly due to the fact that it helps with blood sugar control,
Yeah.
and if we can improve blood sugar, because certainly having high uncontrolled blood sugar is a significant risk factor for
Right.
heart disease. I mean, it ups the risk of heart attack
Yeah.
significantly. So maybe someday that
Yeah.
will be something that we
Yeah.
recommend.
Yeah.
but it's
But right now, I think it's a little bit early. But yeah, Kyolok is great. Fish oils, omega-3s,
Yes.
just because they, again, offer so many benefits. They're good for the heart, good for the brain, good for the skin.
Yeah.
yes, all the nice
Yeah.
things. It's like the base of your house. I always say when you
Yes, the
nail
base.
down.
Yes.
Yes, that's the base, and
Yeah.
then you build other things and trends and what you feel like mushrooms and all of that. But
Yes.
if you have a good
Yeah.
heart
Yeah.
and your brain is there,
Yeah.
you're in pretty good shape,
Yes,
right?
that's right. You
That's
got to
a good
take care of the
start.
foundation.
Yeah.
Yeah, exactly. That's
Yeah.
the words I was looking for. Yeah,
And the
foundation.
problem is sometimes the foundation isn't trendy and it isn't fun, and,
Well,
and
that's it.
people start to forget about it, right? They don't
Yeah.
pay attention to getting that base
That's
really
right. And I
strong.
think,
Yeah.
too, if people are getting their information from TikTok or, I know that's popular, but I
Yeah.
tell my 13-year-old son, not everything you see on TikTok is true.
Yeah.
No, exactly.
So be careful, because he'll watch something and come to me and say, "Oh, I saw this," and
Yeah.
I'm like, "No, let's take a look further."
Yeah.
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 So people have to be careful, and I think for retailers too, being aware of the trends, because people will come into their stores and say, "Oh, I saw this video, and what is there any truth to it?" And so being able to kind of help sort out the fact from the
Yeah.
fiction
Yeah.
can be very helpful for
Yeah.
people.
Absolutely.
What kinds of heart health trends have you seen over the years? Anything that kind of stands out for you?
Yeah, I think there's a few things that I have really noticed. I mean, I've been practicing for 30 years, and I remember when I first started practicing, the whole concept of folic acid
Yeah.
was considered new for helping to lower homocysteine levels. Now,
Right.
that's kind of a widely accepted foundational thing that most people realize has benefits.
Yeah.
I would say some of the trends that I've noticed when it comes to supplement development and marketing, even promotion, is just the fact that now today we have better forms of some of those foundation products. For example,
Right.
if we look at fish oil, 20 years ago, people didn't want to take fish oil because they had fishy burps.
Yes.
Yeah.
Or then reports came out that there was PCBs and mercury and dioxins in the supplements. So now
Yes.
you have these ultra purified forms of fish oil that are better tolerated, that are sustainably sourced. So I think that's a big trend. People are reading and interested in taking
Yeah.
things that are good for the environment as well. Understanding that Kyolok, that yes, it's been around for decades, for 50 years, I believe.
Yeah.
But they have more and more research behind it, and they're coming up with different combinations and formulas. So I think formulas that can attack multiple health goals is another trend.
Yeah.
And,
Yeah.
and also products that can offer certain advantages, for example, enhanced absorption and bioavailability, which is big for coenzyme Q10 and turmeric or curcumin products as well. So I've seen, trends going into looking, okay, we've got this is great, but how can we make it better?
Yeah.
We can
Yes.
improve the tolerability, we can improve the bioavailability or the absorption. So I think those are some of the trends that I've really noticed.
Okay, very good.
Go
I
ahead.
was to say we have both so many
Yeah.
questions for you. In store, how would you make it like a easy communication when somebody come in and they have heart issues or they want to prevent? How
Well,
do we go about that?
a couple of things, because it's similar to in the pharmacy when people come in to
Yeah, that's what I
say they're
always-
getting one
yes.
thing. Maybe they're getting something for digestion or
Yeah.
heartburn or whatever. Just, opening up that conversation, have you been screened for heart disease, or do you have any concerns about heart health? Some people are like, yeah, I've never had my blood pressure, cholesterol checked. I don't know where I'm at.
Yeah.
Encouraging them to have some of those baseline screenings and to be aware that there are things they can do for prevention.
Yeah.
Because I think people need to hear that message from trusted sources. People that go to the health food stores, they trust
Yeah.
the people that work there, because today we have the people working in health food stores, I mean, they've always been passionate and knowledgeable.
Yeah.
But now we have even higher bar where people are having certified as nutritionists or supplement advisors. So the quality of information and education in the retailers and the health food store has improved significantly.
Yeah.
So having that open conversation and, asking them if they have any questions or if they'd like any recommendations, pointing them to some reliable sources, and even offering webinars or seminars to help.
Yeah.
That can be a good way to educate and inform and empower people as well.
Yeah, because it's a topic that is definitely not like, oh, I have eczema on my skin and I want I think for people who work in the store, they get a little nervous.
Yeah, it's a deeper
exactly,
conversation.
because of medication that people can be using and
And to
such,
be aware that there can be interactions, and that's why it's good if there's somebody on staff, a naturopath or somebody who has knowledge about potential drug interactions, or even working with the customer's pharmacist, trying to open up the lines of dialogue. I mean, I was always happy when I got calls from colleagues, whether they were at health food stores or wherever, just to discuss what we can do to optimize their mutual patients' health.
Yes. So what would be some source of knowledge? Like, I mean, you won't be on call for all the health food store and ask you questions. I'm sure people would love that. But is there some other resources? I know for us, we have the educational portal that has the information for our retailers
I think
on the
educational portal is so valuable, offering those things for the retailers. And for the retailers, if they can offer educational things for their consumers as well, for their customers, again, whether it's webinars, seminars, having meet and greet days where you have, say, a person coming into the health food store that is there to answer questions. Because sometimes people are hesitant to come to a seminar with a bunch of other people, but they're more comfortable coming in for one-on-one consultation. Even if it's a 10, 15-minute event where they can come in and ask questions.
Yeah, that definitely gives you a little bit of...
And the FaceTime. Because
you're creating that trust level too, right?
Yes, improving trust.
Yeah, absolutely.
Yeah.
Amazing.
Go on to
let's hit some rapid fire.
Yes, so some quick fun question for you. So I think you're starting that portion.
I have a question. Sherry, what would you say was your first sort of favorite natural health product?
My first favorite natural health product, it was a very basic one, and that was a multivitamin.
Nice.
Yeah, and it was when I was newly diagnosed with celiac disease.
Right.
And I had discovered that because I was undiagnosed for 10 years and I was just so depleted in so many nutrients, taking a multivitamin was very transformative for my health.
I bet.
Yeah.
And I was also taking some injectable vitamins at the time. But that was my first supplement, a multivitamin, then vitamin C. I mean, and then if you ask me today what I take, it's a long list.
There's a couple that I've added.
I have a container that I have them all so that I remember to take everything. Because I do take a lot of things. People are always like, what do you take? I was curious about what I take. And I do have a pretty substantial list. I mean, things that we're talking about today, I take kyolic every day. The aged garlic extract. I take omega-3s. I take probiotics. Astaxanthin. I take vitamin D, vitamin C, collagen, because I was 55 years old. I want to do what I can to keep my skin healthy.
That's like a non-negotiable.
Collagen is a couple of those a day.
I'm with you.
That's right. Yeah. So.
Yeah, it's we ask that question to our
a lot of our guests.
Yeah, a lot of our guests, and it's always fascinating because I remember, like, when we talk about it at the beginning, you remember brands or products that are not even on the market anymore. Yeah. But just to see how we got into it, basically,
where it all started.
Oh
right?
Yeah, it's fascinating.
Yeah, no, I love all of that stuff, and I take magnesium. I take
that's one.
Magnesium at bedtime.
Yes.
I also take sage.
Yeah.
And I take red clover.
Yeah.
So I'm in that.
Is there anything that changed when we were talking about traveling earlier? Is there anything that you add other than extra probiotics maybe when you travel?
Yeah, when I travel abroad, I do take more probiotics.
Yes.
And I take all of my staple vitamins, but I travel with like a kit of all kinds of things,
Yeah.
just in case
Well, yeah,
my son or
you'd be
myself
prepared
come
for
down with a
anything, too.
sore throat
Yes.
or tummy troubles. Also colostrum, bovine colostrum. So
That's
if you're
that's a new. Well, it's kind of, it goes in cycles.
Yeah.
So
I would recommend that if you're going to India or
Yes,
other
I was-
places, because if
Yeah.
you get traveler's diarrhea,
Yeah.
yes, probiotics for prevention,
Yeah.
and they do help with treatment as well. But colostrum can also help by putting in those vital nutrients and cofactors that help to
Interesting.
normalize the
I wouldn't have
gut.
thought colostrum for that.
it's funny because I
Yeah.
bought a bag when we were in the U.S.
Right.
but I didn't know. I said, "Oh, I heard about it. I'll buy it." But then now I
Yeah.
know. There
Yeah.
you go.
It's
gonna be
definitely
my
a-
suitcase for traveling. Thank you for that. What's your favorite way to stay active?
Well, I have a 13-year-old boy,
That's what-
so
yeah,
he
that
keeps me
starts
active.
there. Yeah, yeah,
And a
exactly.
dog. I have a
Oh, you
foster dog. His
Oh.
name is Buzz, and he's a golden doodle, and he loves to walk. And
You're
I
active.
love to walk,
Right.
but
Yeah.
now I walk like 3 times a day because when I have him, I have him part-time,
go.
6 weeks on, 6 weeks off. When his mother's away working, then I have him.
Yeah.
And I'm also a fan. I have a Pilates reformer, so I do my Pilates reformer, and I do weights, and I do
Yes.
these 15-minute workouts. I mean, I don't go in the gym. I used to teach fitness classes.
Yeah, that's-
and then, it's not that I love doing it, but it was
Yeah.
just the time commitment and just getting out there. And I just found that if I can do it in my own home, I have a lot of equipment. There's no reason why I can't.
It happens,
Right.
right?
It happens.
Yes.
And I notice when I exercise regularly, I
Yeah.
feel better.
Yeah.
Yes.
And when I feel better, I sleep
Yeah.
better. And it's just, so if ever I stop working out and then I'm like, okay, wait a second, something's getting more
something's
snug
off.
or something's off. I
Yes.
know I got to get back to
Yeah.
it. So
Yeah.
yeah, I do that. And we scuba dive and we hike. And so whatever the season is,
Outdoors.
It's very active lifestyle.
very active lifestyle.
Yeah.
Yeah. I hate sitting. I don't
Yeah.
like to sit.
Yeah.
It's bad on my back, and I just don't feel good when I sit for long periods of time.
Yeah,
So.
I find that through the years, and even when we listen to other podcasts and Dr. Uberman or all the others out there, and there's a lot of a change in the routine, what is suggested, right? And as you said, first of all, it has to happen.
Yep.
That's the
Yeah.
first thing, but doesn't need to be those long hours.
That's right. Some of the latest research has pointed to the benefits of like a 10-minute workout.
Yes.
So
yes.
rather than, and I think that's good for people to know, because a lot of people will say to me, I don't have an hour to go to the
They feel
gym.
guilty
And I
too.
say, you don't
Yeah.
need an hour. You can use your own body weight as resistance and
Yeah.
do a 10-minute workout.
Yeah.
And you can have, that can be very powerful.
Yeah,
You
the
can,
impact that's
yeah,
having
burn
is
calories
very
throughout the
large.
day, and it's
Yeah.
good for flexibility and strength.
There's also, and I think it goes in line with that research you're talking about, women's, and now at a certain time, I don't know your thoughts on that, but when you get closer to menopause or premenopause, that doing like little sprint, but short, like a 10 minutes.
Yes.
And you go hard for like 10 seconds, and then you recoup for
And
the
do
rest.
a recovery, yeah,
Yes.
like a
HIIT
20-second,
training kind of?
yeah,
Like HIIT
like
training
HIIT
kind of.
training.
But
High
yeah,
intensity?
short.
Yeah, short little stints, and that's
Yes.
actually what I've been doing lately. Is
Yes.
I do 20 seconds of a really intense activity, giving
Yeah.
it my maximum exertion,
Yeah. Like
a hard
followed by
biking
a
or-
recovery,
Yeah.
Yeah.
where I'm still moving my body and doing another activity, and then going back to it, doing a couple of cycles like that.
Yeah.
So, and I think too, if we can get that message out to consumers, patients, that, because a lot of people will put up all kinds of obstacles about exercising, but if they know it, you can do it in
easy.
10 minutes.
Yeah.
Yeah,
Who doesn't have
exactly.
10 minutes a day,
Yeah.
right?
Exactly.
If you could choose another career, doesn't need to be within this industry, what do you think it would be?
Well, when I was a little girl, I wanted to be a truck driver
Oh, yeah?
Really?
because my dad was a truck driver, and I thought that was super cool to
Right.
be
Visiting
driving the
different
transports, and you
places.
sit up so high, yeah, traveling. And then I wanted to be a flight attendant when I was a teenager because I thought that was glamorous. And
Well, it was
again,
back in
traveling.
time thinking,
Back then
right?
it was.
Yeah, it was thinking.
Yeah.
of-
So, and then at one point I wanted to be an accountant, and then I ended up going into sciences because I was fascinated by medicine and health. If I were to go into another career, knowing what I know now, it probably would have been to become a naturopathic doctor.
Yeah.
That would have been it.
Yeah.
Yes.
That makes sense.
I mean, I still have always practiced holistically, but I'm not a naturopathic doctor.
Right.
And I totally appreciate and value that level of education and specialty they have with holistic therapy. So if I were to change directions, that would have been it.
Yeah.
It's
or
fascinating.
a flight attendant.
Or maybe that on the side.
Yeah, exactly. Just to get all the travels
That's
and go.
right.
But you could have done
I love
your
to
practice.
travel.
Your practice. No, don't eat that. That's not. Just take the supplements with it. I think about that every time I'm on the plane. I always look at people. I'm like, oh, maybe you should. No.
I always bring my own food on the plane.
Me too.
And
Exactly.
people will look over because I have it not just for myself. It's Phoenix. I have like salads. I've got spinach, and for him, it's cut up, vegetables, cucumbers, and everybody around us is snacking on chips and cookies and this and that. And I mean, we have those things
for sure
from time to time.
Yes.
But Mom always comes packed with the healthy snacks on the plane.
Yeah.
As you said through the podcast, it's prevention too, right?
Prevention.
Yes.
That's right. And we're not going to be good 100% of the time.
No.
But if 80 to 90% of time we can do what we know is best for our bodies,
Absolutely.
it's going to carry us a long way in terms of reducing risks of chronic disease.
Absolutely.
Yeah.
Well, it was a treat to have you, Sherry, with us, honestly. I know
Thank
you're
you.
very busy. You're in demand a lot. But it's so important for us to have somebody that was in conventional and as a pharmacist and speaking, in the natural way in prevention. So,
and
it was...
take an opportunity, I think, to bring that attention to that heart health as well, right? And really kind of give us some tools and ideas for the retailers as well.
Absolutely.
My
Because,
pleasure.
we think about it, but we don't necessarily put it to the spotlight. And I think it needs to come there too.
We all need to do more, I think, to educate people about heart health and heart disease risks and prevention, because that's what it's all about. No, so thank you for the opportunity. It was nice to be here.
Thank you.
Yeah.
Okay, let's do a little new to Purity Life.
Exciting this week.
We talk a lot about protein, the importance of protein, of protein, especially for women, and how a lot of times it's kind of inaccessible or not really...
The look
doesn't
is scary.
really call out women. So we have this brand Glow Body, founded by women, made for women, and it's super accessible. The packaging is just kind of jumps off at you.
Absolutely. And for those who are listening, the color is very, I would say, very light, pale,
almost a pastel.
So very approachable, and that's the comment that we receive or we hear often from women, as you mentioned earlier, that the packaging are a little aggressive, where this really speak to women, like in a quicker way. I would say they have great a flavor.
So this one's the grass-fed whey isolate with collagen.
Yes.
And it is packaged also for those of you that aren't watching in a bag versus kind of that 2-pound tub. You're still getting that 2-pound quantity, but it's in a nice big
Absolutely.
bag. That's easy to use.
And the things to note as well is not only there's 27 grams of protein, which is perfect. There's 5 grams of collagen, but also the bag you can read easily. You can't miss the information on
clear,
it. So it's very easy to look at the different flavors. They also have a fuzzy peach, and Erin just had a
so
shot
they have
at
this
it.
Glow Aminos. An amino acid supplement, and
Yes.
we mix this up and put it in my drink, and man, does it ever taste like fuzzy peaches.
It is.
And you said you didn't even actually know what a fuzzy peach was.
No,
so
my
growing
apology.
up, my sister's favorite candy was fuzzy peach.
Really?
And they nailed the taste on this. It's
And
very
that's
good.
one thing with protein or that category, the aminos. People like different flavor, and they like to change, their what they're going to take from a month to another, and I think that their tasting is amazing. Like the flavors,
she did a really good job about that.
Exactly, really hit what it's on the packaging. So looking forward to taste the cookie cream, everybody. I love that. So it's a new brand for us, and definitely hits that market, the ladies, but
sweetened with stevia and monk fruit.
Absolutely, very good.
It hits well.
Yes. Another one.
Yes.
It's called Metavo. So this one is made with avocatin B, and there's chromium in it. And the usage of that product is to help to manage and control your blood sugar. So pushing forward, what does it do for you is basically to help, in weight loss or weight management, because it helps to calibrate, if we can say that, your blood sugar, and by doing that you have less craving.
Yep.
You're less inclined to jump in to grab any kind of snack.
Yep.
So while we're there's no miracle in weight loss or weight management, this is very helpful to get you to that baseline and very balanced energy.
Yeah.
Right? So, give it a try.
And that one's in that bright orange box. So the Metavo name is a combination of metabolism and avocado, which is where that key ingredient is coming from.
Yes.
But well packaged. They have even listed on the bottle. They've got different levels of activation. So they've got day 1 through 14 to activate, 15 to 30 to optimize, and then day 30 beyond, they've got maintain. And they have it in the powder. So this flavor of the powder, you can really mix into anything.
Yes,
it's just
exactly.
Natural, unflavored.
Yes, and the cool thing, again, for those who are listening, it's so bright packaging that when you put it on your shelf, people will stop and look at it. So there's a lot of option in that market, but this is really neat and very popular. So that's just another type of ingredients that could give you some benefit if you're looking to maintain or give you a little help in your weight loss or journey.
Yeah.
Yes.
And that's what's new to Purity Life. Thanks so much again for joining us. What a great episode we had with Sherry and talking about heart health.
Yes, very important.
We're always looking for your feedback, so don't forget to send us some emails. We are marketing@puritylife.com, and certainly follow us or DM us. You've got Purity Life Health Products LP on Instagram. I'm at Erin G. Macklin.
And JD_Girl Power.
So you can always find us there, and definitely stay tuned for next week. We're going to have Aaron Skelton, the president and CEO of the CHFA, talk with us then.
Stay tuned.
Thank you.